Hi, my name's Dr. Elizabeth Hawkes, and I'm a consultant ophthalmologist and oculoplastic surgeon based in London. I have a specialist interest in blepharoplasty surgery and facial aesthetics. So, who is a good candidate for tear trough filler? So, firstly, the tear trough is described as the region between the lower eyelid and the cheek. And the tear trough deformity is a groove that starts to develop over time as the facial structure ages. So it's important to know that the eyeball is in a bony socket called the orbit and is cushioned in fat, which is called the orbital fat. Over time, this fat starts to bulge forward, and that gives the appearance of eye bags. This, on top of the appearance of the tear trough deformity, starts to give the appearance of an aged appearance of the face. So who is suitable? So anyone who starts to develop that tear trough deformity would be a suitable candidate for tear trough filler. So what's best for the tear trough region? Dermal filler or botulinum toxin? So firstly, it's important to understand what the two different types of treatment do. So tear trough filler is a gel made of hyaluronic acid, and hyaluronic acid is a naturally occurring substance that's found in our skin, in our eyes, and in our bodies, and it's also degraded naturally. So tear trough filler works as a gel. So for the tear trough deformity, for a volume loss and any hollow appearance, a tear trough filler would work very well. Botulinum toxin is a neuromodulator, and this works at the neuromuscular junction. Essentially, when a muscle contracts, and repetitive muscle contraction leads to the formation of fine lines, specifically around the eye, the smile lines. So they work differently. So botulinum toxin works quite well for the smile lines in order to soften the appearance. Used in combination with dermal filler can help to enhance and restore the natural beauty of the eye. So what age is it okay to start to have fillers? So thankfully, there was a law passed recently this year stating that anyone under the age of 18 is not able to have cosmetic dermal filler or botulinum toxin injections. And really, dermal filler for this region in particular is only necessary after about the age of 30 when the tear trough deformity starts to develop. There's no specific age. Everyone's anatomy is different and unique, and everyone's face will age in a different way. The key thing you can do to delay the onset and requirement of dermal filler and botulinum toxin is to use SPF and with a high factor for sun protection, as the sun is the single most important factor that accelerates the aging process around the face, and particularly the delicate eyelid skin. So dermal filler safety is an area of interest of mine, and actually the tear trough region in qualified hands is a safe region. However, the key thing before you consider any type of facial aesthetic treatments is to ensure you see a qualified practitioner who is experienced in facial aesthetics, and particularly the anatomy around the eye and the eyelid is very complex and needs to be done in qualified hands. So when should you start to consider surgery? Myself, as a dedicated eyelid plastic surgeon, I've spent 16 years solely focusing on the eyes and the eyelid complex. So it may not be a specific time when you would be suitable for a lower eyelid blepharoplasty or eye bag removal. It depends on the practitioner you see. A patient may come to me and think they need tear trough filler, but actually they would be more suitable with a surgical lower eyelid blepharoplasty. For example, if they have prominent eye bags, excess skin, or a very loose eyelid. And similarly, a patient may come to me and say, I would like to have a surgical blepharoplasty as a permanent solution. However, I would feel that by adding some tear trough filler or some botulinum toxin would enhance the appearance of the eyes and give just as much of a natural result as surgery would.